program in Clare, they're mainly based in the Clare clinic, but we have our clinics at Borough and at Stowtown. So they will travel with the GP to those out clinic, and then that's worked around their tutorial, their video conferencing tutorial.
As part of the Clare Medical Centre, we have the opportunity to do quite a lot of parallel consulting with the GPs here. And sometimes if we're on call with one of the doctors, we have the opportunity to go to the Clare Hospital if there's any emergency patients that come through there.
Apart from that, sometimes we get theatre. I would say once every couple of weeks we get some anaesthetics exposure in the theatre, and if we can squeeze in some clinical sessions during that time, we do that as well.
So day-to-day often involves having the students sitting in with me in consulting in clinic, joining me at hospital for on-call or ward round, joining for procedures, assisting in theatre, really anything that the rural doctors are doing, they'll join us with. And also one day a week I'm involved in one-on-one teaching and mentorship with the students. Often we take it off campus and go to local cafes and see the sites around Clare as well while we're talking about how the teaching is going, discussing cases, doing more didactic teaching as well.
First of all, it's probably just touching base with them and just seeing where they're at with their roster. I also work as a clinical assistant here at the medical centre in Clare, so that gives me the opportunity. I work alongside them in the treatment area, and also too dealing with any issues they may have with the accommodation, if they need any personal support. So it varies from day to day, but it's fairly structured with those things.
So the fifth year students, or any students really, but fifth years who are with us for the whole year, they'll have a session with us, and that involves seeing patients by themselves. Take a history, do an examination. When they've finished their bit, they'll let us know and then present the patient to us and come up with a treatment plan. And it's a good opportunity. The patients love it. They often get a little bit longer to talk about their issues.
So in terms of student supervisor and GP academic, I love both of them and I think they're great. So Leanne is our student supervisor and she is really, really good at communicating everything to us and making sure we're doing well, and she checks up on us all the time. And Darcy, who is our GP academic, very lovely as well. We have tutor there every Thursday morning. Again, very, very good with feedback and just checking in on us. Both of our supervisors have just been the loveliest people.
I've had such a great time. I'm very biased, but I would say has some of the best views and just have had such an awesome time getting out and about. I've definitely been more outdoors this year, I think, than I've ever been in my entire life. We have the great Riesling Trail. A lot of us go running in. It's just such a beautiful place.
I'd say Clare is a really beautiful and lovely place to live, and it has definitely blown my expectations out of the water. And in terms of like shopping and the little main street as well, it's really, really nice, and you got basically everything you need. So this is my first time living not in the city pretty much, and I'm really glad I've done it because I found that everyone in the community has been super welcoming and very eager to get to know the students as well. So in terms of community engagement, we've been going on Clare Medical Centre walks on Thursday mornings where we get the chance to talk to a few of the regular patients from Clare.
We've also been able to do quite a few park runs. I think I hit my 15th park run last week. Just being able to get to know the community a lot through there as well, and everyone's been so lovely and welcoming.
One of my highlights is seeing them create really good relationships with my walking group members. There's been a number of students that have created quite close relationships outside of work. Inside of work, I like helping to teach them and to bring forward the next generation of healthcare providers, hopefully into our community, but into the healthcare community as a whole.
Seeing the Southern Lights, we drove out to a point about 20 k's from Clare and we went on top of a lookout and we got some really nice pictures and a really nice view of the solar storm.
I have to say the highlight has been the outreach trips that we've been able to do with Dr. Michael Nugent, just to get to know the different issues that they face and how that's overcome, and the importance of having locum doctors doing visits quite regularly to these locations. It's just been wonderful to learn that.
Yes, I I've been going to Far West New South Wales for 15 or so years now, and I've been taking students and intern doctors for a long time, and that's a great trip. The medicine out there is more chronic disease based. Diabetes is a huge issue in the Aboriginal community and leads to health problems a lot sooner than the rest of us. Part of the trip is the remote experience too, and getting out to Menindee Lakes or some sort of underground opal mines or whatever, and that it's a combination of looking at Indigenous health factors. Some of the communities are more traditional than others, and then also getting a remote experience.
Yeah, I absolutely would. Variety of reasons. I would say we have a great accommodation that we've kindly been provided by the ARCS faculty, and yeah, we've just had such a good time living together with the medical students. And in addition to that, obviously the clinical placement's been amazing. There is about 15 to 16 GPs at Clare Medical Centre with different specialties, so in anaesthetics and obstetrics and gynecology, child health. So it's been amazing to learn from them. They're just so experienced and have a wealth of knowledge that they've imparted on us already.
So I'd 100% recommend coming to Clare. I think that the way they run the program here is really efficient and streamlined. So having the clinical sessions with different doctors, it's run in a great way. And everyone's got their own niches and their own specific interests. So we get a lot of experience with doctors that are more into dermatology or into obstetrics, pediatrics. So I think it's a really wide variety. Yeah, I don't think you'll regret it if you end up coming to Clare.
I would say just do it. Just getting outside of your comfort zone and experiencing what rural life is all about is a great opportunity. Things out rurally are quite different to metro, and just having that experience is great. And we know that people who experience rural during their training often end up giving back rurally, whether that's through becoming a GP or offering specialist services back to rural areas. I think it's a really important thing to try and do if you get the opportunity to do it. I'd just like to encourage any students, if they're thinking about going rural, to give it a go and immerse yourself within the practices and within the community. You'll really get so much more out of it. And even if it's not sports orientated, we'll find something that you're interested in, and if not, just try something new, give it a go.
I think everyone knows there's a huge academic benefit to having the same set of teachers, having people who are more invested in your career than you'll have when you're one of many at the back of the ward round on a city hospital rotation. You'll have the ability to find a mentor that you can stay in touch with through the early parts of your career. You'll have the opportunity to have people who will go to bat for you with referees to try and get you the best jobs as a junior doctor, and you might even decide that you like rural medicine.